Good afternoon, everyone. My name is Pam Tobin. I'm the CEO of CMHA Thames Valley and Addiction Mental Health Services. I'd like to extend a warm welcome to the Honourable Sylvia Jones, Honourable Rob Flack, His Worship Josh Morgan, Mayor of London, our amazing executive leadership team, and to our partners on the Heart Hub project. Our partners include Arcade Street Mission, Goodwill Industries, Ontario Great Lakes, and Middlesex London Ontario Health Team, Salvation Army Centre of Hope, St. Joseph's Healthcare London, St. Leonard's Community Services London and Region. I'd also like to acknowledge Chief Thomas and Chief Cornelius, who are here with us today. And I'd like to thank Bill Hill for starting us off in a good way. I'm honoured to have the privilege to live and work on the traditional lands of the Haudenosaunee, the Lunapawek, Attawandaron, and Anishinaabeg people. Since time immemorial, they've been stewards of this territory and have ensured its sustainability for future generations. Treaties in this territory date back to 1701, and they're still relevant and honoured today. Despite ongoing colonial processes, First Nations, Inuit, and Métis people are resilient. We can learn so much from Indigenous knowledge, but it starts with truth and reconciliation. I call on everyone here today to take the time to learn about the distinct cultures of the neighbouring communities to London. Chippewa of the Thames First Nation, Munsee Delaware First Nation, and Oneida Nation of the Thames. By building strong, trusting relationships, we can provide better mental health and addiction services to individuals in need. This funding will enable us to better support Indigenous clients on their journey to wellness through Indigenous navigation services. CMHA Thames Valley is the leader in community-based mental health and addiction services. We're the largest branch in Ontario with more than 650 employees serving South Huron, London Middlesex, Oxford County, and Elgin County. We provide services and programs throughout the continuum of care, from initial crisis response to long-term recovery support and housing. Last year alone, our in-person and phone-based programs served more than 45,000 clients throughout our region. Partnerships with other community-based service providers is critical to ensure we're not duplicating services, but we're collaborating to expand reach. For example, in the past year, our crisis services, including our 24/7 centre in London, has diverted 1,547 clients from emergency departments throughout our region. We could not do this work without our community, police, and paramedic partners. We're so grateful for the province's support and recognition of the important work that we do, along with our community partners. I am so thrilled that through Heart Hub funding, there will be a place for clients to have wraparound supports on their journey to wellness. There will be 60 beds available within the centralized Heart Hub, with an equivalent number of supporting housing beds available outside of the Heart Hub. In addition, projects are already underway that will continue to expand capacity of London's supportive housing units and affordable housing to ensure clients have a pathway to long-term sustainable housing solutions. I look forward to planting the seeds of hope to support mental, emotional, physical, and spiritual health and well-being of all of our clients. At this time, I'd like to welcome Minister Jones to the podium. Thank you.
Thank you, Pam, and good afternoon, everyone. It is wonderful to be back here in London again alongside your local MPP, Rob Flack, who has been such an incredible advocate for the Southwestern Ontario region at Queen's Park, and together with all of our Cabinet and caucus colleagues building a more connected and convenient healthcare system in the London region and indeed across Ontario. On behalf of Premier Ford and our entire government, I want to thank CMHA Thames Valley for hosting us today and for everything you do to provide exceptional community-based mental health and addiction support to families in the London area. I also want to recognize Mayor Morgan, Chief Trong, and all the partners and local leaders who have joined us for another exciting announcement in London. I was just over a week ago here when our government announced our investment to add 4 new operating rooms at London Health Science Centres. And today, I am excited to join you once again to share another way our government is making it easier for people to access the care and support they need close to home. Under the leadership of Premier Ford, our government has been making record investments in healthcare to build a system that puts people at its heart, taking bold and innovative action to connect families to the care, treatment, and supports they need when and where they need it. Through our government's roadmap to wellness, we are investing $3.8 billion over 10 years to fill gaps in mental health and addictions care, create new services, and expand programs. As part of our 2024 budget, we are investing more than $500 million over 3 years to create more supportive housing to address unstable housing conditions for those experiencing mental health and addiction challenges. And we are continuing to improve access to mental health support services across Ontario by creating over 550 more addictions recovery beds, adding 100 new mobile crisis response teams, including one operated by CMHA, Thames Valley, and by expanding our Youth Wellness Hub network, including through the London Middlesex Hub, to bring the total to 32 opened across Ontario since 2020. Today, I'm excited to announce our government is continuing to build on the progress we have achieved to date to connect more people to the treatment and support they need when they need it, while continuing to build safer communities by approving 18 new homelessness and addiction recovery treatment hubs, including right here in London. These 18 new hubs are in addition to the initial 9 drug injection sites that are transitioning into heart hubs, bringing the total number of new hubs to 27 across Ontario. And we will be supporting through our government's $529 million investment. Our decision to create 8 more heart hubs and increase our investment by over $150 million than initially announced recognizes the unique needs of communities across the province, and I may say some very unique collaborative applications that were submitted, and the steps our government is taking to build a responsive, comprehensive healthcare system that connects you to the care and support you need no matter where you live. In addition to the hub in London, the 18 new heart hubs will be located in Barrie, in Belleville, in Brampton, in Dufferin County, in Kenora, in Lanark, Leeds, and Grenville County, in Memising, in Niagara, in Oshawa, Ottawa, Oxford County, Peterborough, Renfrew, Sarnia, Sault Ste. Marie, Sudbury, and Windsor. Each of these new homelessness and addiction recovery treatment hubs, or heart hubs, will have a goal of being operational by April 1st of 2025. Our government recognizes Ontarians deserve more than a healthcare system that provides them with tools to use illegal drugs. And today, we are taking the next step to help more people get the treatment and support they need to break that cycle of addiction and take steps on their road to recovery, giving them and their families hope back. The Heart Hub model is based on existing integrated hubs in Ontario, including 2 in London that, thanks to the work and advocacy of Mayor Morgan and partners across the region, have successfully provided people with care. Through today's announcement, we are championing the innovation that began here in London, and to connect people with complex needs to tailored comprehensive treatment and preventative services in every corner of Ontario. Each Heart Hub will reflect regional priorities and include a range of services to meet local needs, such as primary care, mental health services, addictions care, social services, and employment support. Heart Hubs will also add an estimated 540 highly supportive housing units, in addition to addiction recovery and treatment beds, helping thousands of people each year transition to more stable, long-term housing. All Ontarians, including those struggling with mental health and addiction challenges, deserve convenient access to care, to support, to resources, and treatment options. Establishing a total of 27 new heart hubs across Ontario is one more way our government is improving access to mental health and addiction support services that better reflects the needs of people and their families experiencing mental health challenges. Thank you again to CMHA, Thames Valley, and all the healthcare workers and organizations in London and across the province who, over the coming months, will bring those heart hubs to life. It's now my honor to invite MPP Flack to share a few words. Thank you. Stay well.
Well, let me begin by thanking you, Deputy Premier, for coming to London again. And I would say that every time you come, you bring good news. So you're welcome here every week for the next number of weeks, and I think everyone in this room would be most appreciative. Great to be here with you, Mayor Morgan, Pam and Dean. This is incredible healthcare news, not only for London and our region, but throughout the entire province. What an asset these heart hubs will be to our community in treating people who are dealing with the enormous challenges they face day in and day out with addictions and mental health challenges. It's an all-of-community response. We respect that. There are comprehensive supports from primary care to mental health, which I like. Primary care is so important to what we do every day and continue to support. And London is obviously one of these communities that the Minister spoke of, and we're very fortunate she chose us. $527 million. So we think upon that sometimes as a cost, but it really isn't. We're investing in people, we're investing in our communities, and we're investing in high-quality health care to all Ontario families. Folks, under Premier Ford and Deputy Premier and Minister Jones, our government is now spending $85 billion a year in health care, up 31% since 2018. $85 billion a year. I think when Bill Davis, Minister, was Premier, the whole entire Treasury was just a little over $30 billion. It is an amazing investment, and it's grown 31% since 2018. And this announcement builds on such great support we recently did. LHSC, I see President David back there and his team, the Nazem Kadri Surgical Centre, just a week ago. We're getting it done for the people of Ontario. Thank you for your time and attendance. Congratulations to the City of London and our region. And I think Mayor Morgan, I'm going to call him up now, but at his State of the Union, he talked about getting a heart hum. And as I like to say, well done is better than well said. So the floor is yours. We got it done.
Well, it's a pretty exciting day for London, and let me start by recognizing a number of my council colleagues in the room. I'll admit that there are committee meetings happening at City Hall right now, so there won't be all of them here, but I see Deputy Mayor Lewis, I see Councillor Pelosa, I see Councillor Lehman, I see Councillor Pribble. There might be more in the back, but also we have a good number of city staff here, including our city manager and a number of deputy city managers. Also community partners who have been with us every step of the way along this journey of going from recognizing at the start of this term of council that homelessness, mental health, and addictions was a crisis that we had to do something about, and pulling together a diverse set of organizations across this community, many of whom have become partners in the Heart Hub led by CMHA, as you heard from the intro, pulling those community members together and saying, we've got to do something different, and we've got to do something that works. At the time of my first State of the City, we had a vision, but we didn't know what would work. We developed a plan, we started implementing it. But at the same time, we started engaging with our provincial partners, including Minister Jones, Minister Flack, and many others, to talk about the work that we were doing here in London and to recognize that these challenges will not be solved by one city alone. And the minister listened. We came with a diverse group of delegates and said, we need to do something different, but we need to do something that has a provincial strategy. It needs to involve getting people out of encampments and off the streets and into spaces where they can wrap the supports around them that they need to take them into permanent housing. And the minister listened. And we talked about supportive housing and the importance of supportive housing as a stable place that people can flow through and get the space they need, the support they need, and the minister listened. And then we talked as mayors to say, This is an amazing announcement when they came out with the Heart Hub announcement. This is exactly what we've been asking for. Investments in hubs and supportive housing, treatment and recovery across this province, something that we felt we didn't have enough of in our city or across the province. Not only did the minister listen, but we talked about your additional investment. Although $378 million was amazing, we expected there would be great demand across the province because communities everywhere want to step up and help. Organizations in those communities want to step up and help. None of us are expecting to do this on our own, and although London may have led on this initially, we cannot solve these challenges without all communities across this province coming together. And the minister listened, and today you hear that they're doing more Heart Hubs with more money than initially planned. That is how you start to solve a challenge. That is how you get ahead of the challenges of homelessness, mental health, and addictions. You get everybody behind a strategy, and you start to put the proper resources behind it. And we are going to prove time and time again this works so that we can take what works and we can accelerate it across this province. It's transformative to be a mayor in a city to know that you have this insurmountable challenge, but have a partner in the provincial government that says, we're going to help you with this, and we're going to be there every step along the way. And so for the announcement today, I want to say a personal thank you to Minister Jones, to Minister Flack. Thank you to your government. Thank you to Premier Ford for listening to us all along the way and coming through with this incredible investment that will now benefit people right here in our community. And it will integrate with our existing hub system. We have 2 hubs, but 60 more people and up to eventually 60 more supportive housing spaces attached to this is going to really give us an incredible amount of new spaces to continue to take people off the streets and out of encampments in this community and get them the care they need. It will be transformative for this community. And not only that, but we are ready to go very quick. So to CMHA and all of the partners, and you heard them at the start, everybody who's wrapped their support around this, this is how you solve a problem. You bring partners together, you create an integrated approach, you eliminate duplication, and you focus on the problem. And I'm very excited about the work that's being done. I'm very excited about getting this thing up and going, and I'm very excited as we ramp things up in the future to continue to have a great partner in the provincial government who continues to help us solve the most significant challenge we have, and that is homelessness, mental health, and addiction in this community. Thank you very much.
Hello, everyone. I'm Dina Stolfi. I'm the VP of Supportive Housing and Program Development for CMHA Thames Valley. We're absolutely thrilled that a Heart Hub is coming to our community. This is a much-needed investment that will build on the incredible work and collaboration that has already been happening right here in London. When we started developing our Heart Hub proposal, we focused on the strengths of each partner involved. London is already home to a wealth of services, and by combining these with the essential investment in Heart Hubs, we know we can improve and strengthen our community even more. In the wide range of services available to our community, Heart Hubs are a welcome opportunity for recovery. Working alongside our dedicated partners, we will create wellness spaces where individuals that are housing deprived will have a safe, secure environment. It's a place where they can focus not on survival or safety, but on their recovery. Each person who enters this space will be met by experienced staff and clinical professionals who will guide and support them every step of the way with options for wellness. Our staff members are more than professionals. They are compassionate individuals who care deeply about each person's journey. They will ensure that everyone feels seen, heard, and supported. For many, this will be an opportunity to break free from isolation and reconnect with a healthy community. Heart Hub services will offer access to essential health care, nutritious food, skill development programs, one-on-one and group supports, and, of course, supportive housing. While most of the core services will be centralized for our Heart Hub, we will also provide specialized support for women at a separate location. Additionally, there will be opportunities for supportive housing at other sites as individuals move forward in their recovery journey. We know that person's path to recovery is unique, and our goal is to empower and support each person as they move forward. In the coming weeks, as we finalize service agreements with our great partners, we'll share more specific details. One thing I can promise is that the work we're doing here didn't start yesterday. It's been in the works for some time, and tomorrow we intensify our efforts. I am deeply grateful to our funders and excited for the journey ahead. Together, we will make this community better, stronger, and more supportive for all who need it. Thank you.
We will, pardon me, we will now take questions from the media. As a friendly reminder, the format is one question and one follow-up. If media present could kindly form a line behind me and ask your questions through the microphone. Please state your name and your outlet before your question.
Hello, Jennifer Beeman, London Free Press. Question on everyone's mind. Where will these hubs be in London?
I can speak to that. We'll be able to announce that very soon. The thing that we have to do first is hammer out our service agreements with our partners. I can tell you that they'll be centralized. I can tell you that they'll exist in spaces that already have community services in them. They'll be in facilities that are familiar to us.
And Londoners are familiar with CarePoint, which is our supervised consumption facility. How will these heart hubs be different? What different services will that facility have? How will Londoners notice a change in that facility?
Sure. So as far as hubs are concerned, the commonality is that all hubs bring people inside. It's something that we're trying to do no matter where you are in the province. I think with heart hubs, what we are doing is we're building upon what we had in mind in London in the first place, and we're ensuring that we have the essential investment that we need in order to do the services that we want. So a heart hub is a journey to recovery, and that's what we intend to do.
Hi there, Isha Bhargava, CBC News. This question is for Minister Jones. You mentioned that 9 supervised consumption sites have closed down and transitioned into heart hubs. Why was London's CarePoint site allowed to remain open?
So the CTS sites that were offered the opportunity to transition into heart hubs were ones that were located within 200 meters of a daycare, a school, or an early on center. And it was really an acknowledgement that consumption sites are not good neighbors with where our young people are learning and playing.
And follow-up for anyone, really. How will the referrals to the heart hubs work, and what happens if, you mentioned people are in different points of their journey. What happens if somebody is refusing treatment and things like that?
Yeah, it's a good question. People can come from anywhere on their journey into a heart hub. Heart Hub specifically is focused on mental health and addictions. So the folks that are coming into a Heart Hub, that's what they're going to be focusing on. It's focused on wellness, so they're going to want to have those options. And it's a coordinated access. We already do a really good job in London with our coordinated access. We'll continue to do that with multiple referral doors. We have system navigators as part of our plan, and they will attach to already what exists in our community as far as system navigation goes.
If I can add to what Dean said, at the beginning of the presentation, you heard all of the partners that are part of this application, this successful application. And I think it really speaks to you have a lot of community engagement already here in London, and the Heart Hub model and the request for those applications was saying, bring those experts together and build an application for a Heart Hub model that is going to make an impact in your community, and clearly London's did that with the list of partners.
Jerry DeWan from CTV News. Minister Jones, if I may. Obviously, the Association of Municipalities of Ontario came out with their research study indicating that homelessness could double within the next decade, reaching 300,000 people. Is what we're doing here today, and what we're announcing here today, going to be enough to address those concerns?
So the association, the municipal leaders, very clearly highlighted the issues that they were having in their communities, whether that was with the homeless population. We have answered that call. We will see, as the Heart Hubs start operationalizing, where the opportunities are. Each of the applications were very community specific. So if we find through the data and the information that we start getting back that there is a particular model that seems to be having a higher success rate, then we will share that best practice with others. As Mayor Morgan said, Premier Ford and I had the opportunity to have an overview of what is already happening here in London. I think you have a pretty good handle on how to make this model work successfully. But one thing that you will see, and I hope you have seen with our government, is as we see issues coming forward, we're there and we're prepared to help with willing partners.
One question on a separate topic, if I may. The CEO of St. Thomas Hospital says it will require an 83% increase in square footage by 2033. Yet they're kind of landlocked and they don't have the space. How do you approach those kinds of demands in those kinds of communities?
So as hospitals assess, review their existing facilities, their existing infrastructure, there are regular and ongoing conversations with the Ministry of Health, with Ontario Health regionally to see what we need to move forward on. You know, last week's announcement at London Health Sciences is a perfect example of that. We saw through the surgical centre a successful model, and they had and presented a proposal to the Ministry of Health that wanted to build on that success. We were able to fund it, and that project is moving forward. That's how all hospitals approach it as they see, for example, their population aging or their population increasing. Then they work very closely with our ministry. I will say, you know, we have 50 hospital capital projects today happening across Ontario, unheard of. And we'll continue to make those investments because as we see people age, as the needs increase, we and our government need to be there.
This will be the last question.
I just want to add something to the first question, because it is a common question that comes up that needs to have some clarity to it. When we talk about hubs and highly supportive housing, we're talking about helping a segment of the homeless population. It's not the only thing we're doing on homelessness. But we have a segment of the homeless population that has very high needs, that is consuming a tremendous amount of services in the emergency room, through land ambulance, through police contact, that if we invest in them and we help them get off the streets and into supportive housing, can pay dividends elsewhere. But we also know that there are people who are homeless because they simply cannot find the type of housing that they can afford in this community. So we are doing stuff on that too. We have the roadmap to 3,000. We partner with the provincial government through homeless prevention program money. We partner with the federal government through Housing Accelerator Fund and other money. We're building new stock at London Middlesex Community Housing for the first time in 60 years. We have rent supplements. We partner with agencies. We do direct builds with community partners. We recognize that homelessness is a spectrum. And so a heart hub and our hub system in supportive housing will help a segment of the homeless population, but by no means are we not active in all of the other spaces that we have to be active in to help with general homelessness in this community. And we do require and we do partner with our provincial and federal governments and community partners and not-for-profits to actually make gains there too. So when the question came up to say, will this address the issue, this addresses a really important part of the issue that is consuming a tremendous amount of resources in this community. But it is not the only thing we're doing, and it is not the only part of homelessness that we are seeking to address. So I just wanted to make that clarification. Thanks.
Did you want to say? Yes, Bienvenue, Senga from Radio-Canada. My question is for the Minister. So I went through the list, and there's one community in Northern Ontario that's still not getting one at the moment, which is Timmins. And it consistently ranks among the top 5 communities that are most affected in Ontario by opioid overdose deaths. I understand they submitted an application back in October. When can they expect to have one?
So the announcement today covers all of the heart hubs that we are announcing and moving forward with this year. The Timmins application, as I said, each one is unique. Each community's submission was unique, and there are some unique concerns, challenges within the city of Timmins that they need to resolve. And then moving forward, as we see these heart hubs succeed, we'll look at expanding that.
All right, that concludes our media questions for today. If I could get the podium party to stay up there for a couple of photos, that would be great. Thank you, everyone, for coming.